Hello, my name is Heather Bowers. I'm a family nurse practitioner and the clinical education lead for the COVID-19 Therapeutics unit. The following is a presentation about COVID-19 therapeutics. Next. After this presentation, I hope you have a better understanding of COVID-19 therapeutics and have additional resources. Next. So with that, let's start talking about therapeutics. Next. So at this time, there are 4 therapeutics authorized or approved for COVID-19. Everyshell is for the prevention of COVID-19, and treatment of COVID-19 in order of preference per NIH guidance is Paxil, remdesivir or Veklury, and molnupiravir or Lagevrio. During a federal call, a theoretical commercialization timeline was provided. It's proposed that Everyshell in early 2023, Lagevrio in Q1 of 2023, and Paxil in mid-2023. Again, we've not received any concrete timeline, and this is just a projection. Next. This table is a quick reference guide for therapeutics that talks about both the prevention and treatments. Next. So what are monoclonal antibodies and how do they work? They are made in a lab, but they work like the natural antibodies that we make. These antibodies attach to the spike protein of the SARS-CoV-2 virus. It keeps the virus from attaching itself to the cells and thus limits the spread of infection, prohibiting it from getting worse. Next. Antiviral treatment targets a specific part of the virus to stop it from making additional copies of themselves and releasing them to infect additional cells. These medications are most effective early in disease progression, so it's imperative to begin the medication as soon as possible after symptom onset. Next. The CDC has updated its site regarding individuals at risk for severe COVID-19 infection progression. And by severe, that means could lead to hospitalization and or death. Age remains the strongest risk factor. Older age is a significant risk factor for both vaccinated and unvaccinated populations. Some people from racial and ethnic minority groups are at a risk of being disproportionately affected by COVID-19 from a variety of sources. You're encouraged to consider these factors when evaluating the risk for severe COVID-19. Additional risk factors are highlighted here, but this list is not all-inclusive. Please visit the CDC list and use clinical judgment when determining if a patient is at risk for severe COVID-19. And as a reminder, only one risk factor is required under the EUA standards. Next slide. We'll first talk about Everyshell. Next. It is indicated for the pre-exposure prophylaxis of COVID-19 infection. Everyshell is not a treatment option for patients currently exposed or infected with COVID-19. It is for adults and children at least 12 years old and weighing at least 40 kilograms. Everyshell can offer protection from COVID-19 for individuals whose immune systems are unable to mount an adequate response from the vaccine, and that's either due to a medical condition or because of taking immunosuppressive medications, or those unable to receive the COVID-19 vaccine due to allergic reactions. It is not a substitute for the vaccine. Its mechanism of action is it's a long-acting recombinant human IgG 1-kappa monoclonal antibody derived from B cells donated by patients after SARS-CoV-2 virus, and it binds to the spike protein and blocks attachment. Next. So this is a review of immunocompromised individuals. This list is not all-inclusive, but shows some examples of people who may qualify to receive Everyshell. The EUA was updated to bold the language, but are not limited to, and that was because providers had been considering this to be a end-all be-all list, and if they're not on this list, they were not eligible. That's incorrect. This is just a guide for some treatments and some medical conditions. It is important to use clinical judgment to define moderate to severe immune compromise in the patient you're seeing. Next. So Everyshell is for adults and pediatrics, at least 12 years old and older. It is administered as separate consecutive intramuscular injections. And on June 29th, 2022, the FDA revised the EUA fact sheet for providers to recommend repeat dosing every 6 months for ongoing protection. However, Everyshell is not for everyone. It is cautioned in prescribing for patients with coagulopathy and those at high risk for cardiovascular events. These SAEs occurred infrequently in clinical trials, 0.6% of participants in a therapy arm and in 0.2% of participants in the placebo arm. It is important to note that these patients had underlying cardiac risk factors or a history of cardiovascular disease prior to the clinical trial. It is not clear if Everyshell caused these cardiac adverse events. And although these events are very rare, it is important as a provider to consider these risks and benefits prior to initiating Everyshell in those that are already at high risk for cardiovascular events. Providers are encouraged to advise individuals to seek immediate medical attention if they experience signs and symptoms suggestive of a cardiovascular event. An additional consideration is that patients must be monitored for 1 hour post-injection, and that's the same for subsequent injections as well. There is no waiting period for vaccination after receiving Everyshell. However, if the patient has received a COVID-19 vaccine or booster, the patient must wait at least 2 weeks after vaccination to receive Everyshell. Receipt of Everyshell does not preclude an individual from receiving COVID-19 treatment if they become positive for a COVID-19 infection. Next. The FDA released important information about the risk of COVID-19 due to certain variants not neutralized by Everyshell. Healthcare providers should inform patients of this risk and advise them if they develop signs and symptoms of COVID-19 to test promptly and seek medical attention right away, including starting treatment for COVID-19 as appropriate if they do test positive. Prescribers should monitor the CDC regional variant frequency data and refer to the table of variants detailed in the fact sheet for healthcare providers for the latest data on the neutralization activity of Everyshell against SARS-CoV-2 variants in your area. Everyshell is currently the only option for pre-exposure prophylaxis of COVID-19, and the FDA continues to recommend Everyshell as an appropriate option for prophylaxis to prevent COVID-19 in combination with other preventative measures like getting vaccinated and boosted as recommended, as Everyshell still offers protection against some of the circulating variants and may offer protection against future variants. Detailed neutralization data can be found in the revised authorization fact sheet for healthcare providers. Next. Paxil is the first treatment drug we'll talk about next. Paxil is an oral antiviral. It is indicated for the treatment of mild to moderate COVID-19. It is for adults and pediatric patients at least 12 years old and older and weighing at least 40 kilograms. To qualify, patients must have a positive COVID-19 test and be at high risk for severe disease progression. Paxil consists of 2 pills taken together, nirmatrelvir and ritonavir. Nirmatrelvir prevents key proteins that the virus needs to make more copies of itself from functioning properly. It is taken in combination with ritonavir, which helps keep nirmatrelvir from being broken down before it has completed its job. It is expected to maintain activity and efficacy against current and new circulating variants. Next slide. However, it's not for everyone. There are significant drug-drug interactions with Paxil and CYP3A medications. Additionally, Paxil is not recommended for patients with severe renal impairment, so that would be those with an estimated GFR less than 30, or severe hepatic impairment, and that would be a Child-Pugh score of C. It is important to complete a thorough medication reconciliation prior to prescribing Paxil. Many routine medications can be adjusted or withheld during the Paxil course. Resources to help identify and manage drug-drug interactions include the Liverpool Interaction Checker, FDA, and VDH's prescriber's checklist for Paxil. VDH now has a Paxil checklist exclusively for pharmacists. Its most common side effect is a bitter metallic taste in the mouth, but also common is diarrhea and muscle aches. Next slide. Again, it is co-packaged as 2 drugs, nirmatrelvir at 150 milligrams and ritonavir 100 milligram tablets. The dosing is 300 milligrams nirmatrelvir plus 100 milligrams ritonavir orally twice daily for 5 days. For moderate renal impairment, there is a dosage adjustment of 150 milligrams nirmatrelvir plus 100 milligrams ritonavir twice daily. Prescription should specify the numeric dose of each active ingredient. Next slide. So this is the packaging configurations. It again is co-packaged in a daily blister card for oral use. Packaging is broken down into normal renal function or mild renal impairment, and then moderate renal impairment adjustments. Next slide. Veklury is next on the list. Next, please. So the FDA approved, so not authorized, but approved for the treatment of COVID-19, both in the hospital and in the outpatient setting. It is currently the only treatment for pediatric patients less than 12 years old. Its mechanism of action is that it inhibits the SARS-CoV-2 RNA-dependent RNA polymerase, which is essential for viral replication. Next slide. This is a reference slide that shows the inpatient dosing for both adults and pediatrics. Next. And then this reference slide shows outpatient dosing with both a loading dose and maintenance dose for adults and pediatrics. Next slide. Individuals need to be monitored for at least 1 hour post-infusion. Remdesivir is not recommended with severe renal impairment and hepatic impairment has not been evaluated. To order Veklury for non-hospital use, please contact AmerisourceBergen Specialty Division or Cardinal Specialty for more information. Those resources, phone numbers, and emails are listed here on the slide for your reference. Next. We'll talk about molnupiravir next. This is an alternative medication, so not first-line choice. It is an oral antiviral with similar indications and eligibility for use as Paxil and remdesivir, but it is not for pediatric patients. It is only for adults age 18 and older in the outpatient setting. Again, it is a second-line option for the treatment of COVID-19 when Paxil or remdesivir are not available or clinically appropriate. Molnupiravir works by introducing mistakes into the virus's genetic code, preventing the virus from replicating properly. Next slide. It's taken by mouth daily times 5 days and should be started as soon as possible, but at least within 5 days of symptom onset. It is not expected to have an effect on renal or hepatic impairment. Next slide. There is a black box warning regarding pregnancy. Based on animal reproduction studies, it may cause fetal harm. Due to the fetal toxicities that have been reported in these studies, the NIH panel recommends against the use of molnupiravir for the treatment of COVID-19 in pregnant patients unless there are no other options and therapy is clearly indicated. The FDA and VDH have a prescribing checklist that details further recommendations on contraception for women of childbearing potential and men who are sexually active with women of childbearing potential. And again, it is not authorized for patients less than 18 years old due to possible effects on bone and cartilage growth. Next slide. This slide houses fact sheets for both providers and patients. Next. So we'll talk about some additional considerations. Next. So administration of monoclonal antibodies may be associated with reactions, and while rare, these reactions may be potentially life-threatening. Patients require monitoring for 1 hour after completion of administration. Healthcare providers may administer monoclonal antibody therapies only in a setting where they have both immediate access to medications to treat a severe infusion reaction, such as anaphylaxis, and the ability to activate the emergency medical response. Next slide. A note regarding pregnant and lactating women. There is a lack of or insufficient evidence. ACOG notes clinicians should weigh the available data against the individual risks of COVID-19 and pregnancy in each situation. The short-term exposure of these medications must be balanced against the maternal and fetal risks associated with untreated COVID-19 and pregnancy. NIH recommends that potentially effective treatment should not be withheld from pregnant women because of theoretical concerns related to the safety of therapeutic agents in pregnancy. So this is a shared decision-making process between the patient and the clinical team. Next slide. Here's another list of some links that are some excellent provider resources. Next slide. So adverse events should be reported to the FDA. MedWatch, the FDA's Medical Product Safety Reporting Program for health professionals, patients, and consumers. And an adverse event is not a side effect, which may be expected. Next slide. So a few words on variants. Due to the changing variant epidemiology and variants that are resistant to bebtelovimab, the FDA deauthorized the use of the drug in the US on November 30th, 2022. This means there are no mAbs that are FDA approved and authorized for the treatment of COVID-19 in high-risk patients. Everyshell, which is also a mAb, remains authorized at this time as a pre-exposure prophylaxis for COVID-19. Healthcare providers are encouraged to monitor the CDC's Nowcast for the latest update information on COVID-19 variants in your region. Next slide. COVID-19 rebound occurs when a person is infected with COVID-19, gets better, tests negative, only to maybe develop additional symptoms and test positive a few days to a week later. It can occur even if the patient did not get treated for COVID-19. There are no reports so far of serious illness from COVID-19 rebound. Right now, the CDC and FDA do not recommend additional treatment. COVID-19 rebound may be a natural part of the illness for some people. And clinical trials for both Paxil and Lagevrio have been updated to include additional studies regarding rebound and efficacy of additional treatment. Next slide. So this concludes our presentation. For any questions on the access or administration of COVID-19 therapeutics, please reach out to our mailbox, COVID-19 therapeutics@vdh.virginia.gov, and thank you for watching.